So here's another example of a toenail removal. This is one in which we are going to remove the entire toenail. We are going to remove it in a permanent fashion. The patient's toenails were severely incurvated. They were severely thick and causing her quite a bit of pain and discomfort, and she was unable to care for them. So you can see we just simply remove the thick nail in its entirety. And this exposes the nail bed and the matrix that the nail grows from. From this point, we are then going to use phenol, which is an acid, and another way to permanently remove the toenail. Here I'm simply using a curette. This will scrape apart the matrix and it makes the cells just more ready and willing to accept the acid and helps the permanent procedure work a little bit better. You do want to make sure before we proceed with the permanent procedure that the bleeding is well controlled, as this can dilute the acid and cause it not to work, leading to a regrowing of the nail. So this is a Q-tip that I have dipped in the phenol, and I'm running it here along the entire nail matrix and down the side, again to kill the cells that the nail grows from. This is something that needs to be done 3 separate times and held for 30 seconds. Oftentimes, the acid won't work or will miss a patch of cells and the nail will grow back. Sometimes it's not a full nail, it's just a small, tiny piece of nail called a spicula. They're lifted off the nail bed and can be uncomfortable to the patient. And to get rid of that, they have to come back and have another procedure performed. Typically, when we see a spicula come back, it comes back from the sides or the corner of the nail, not the center portion. So oftentimes when I'm doing this procedure, I will leave the Q-tips in place for a longer period of time along the sides of the nail, just helping to ensure that we do kill all the cells and a spicula won't grow back. It's always a risk. There's always a risk that the nail will grow back entirely. There are some nail beds that are just very persnickety and the cells won't die and you'll see the entire nail grow back. There's some cells that are just resistant to the phenol and won't work and the nail will grow back. If you don't have the bleeding well controlled, then it will again dilute the acid and cause it not to work and the nail will grow back. So you can see here's our second application to this left toe of the acid. And we're just going to continue to repeat this procedure until each side has been done 3 times. When this procedure fails and the nail does grow back, at that point in time, I will typically do a surgical procedure where I will use a 15 blade and make incisions along the side of the nail, and I will actually cut the cells out. This does require suturing for closure. The aftercare following this procedure is simply just removing a large bandage that I will apply after the procedure is over, washing the toes well with soap and water, applying some cream that we dispense to them the day they leave the office. We use a cream called Revitaderm Wound Gel. It reduces the drainage and helps the wound to heal. They'll apply that daily with a Band-Aid. They'll do that over the next 10 days. And then they'll just start to leave it open and let the area dry. If there is a significant amount of drainage present, then they can soak the toes in Epsom salts. The Epsom salts will help pull the drainage out and help reduce the drainage. After this procedure, patients typically have less pain than they did before because the horribly thick ingrown toenails are gone. If pain starts increasing, that is an early sign of infection And typically I tell them to call the office so that we can possibly get them started on an antibiotic. Drainage with this is normal because you are sort of creating a chemical burn with this acid. It should be a clear yellow to a clear brown drainage. If it turns to a creamy white drainage, then the patient needs to call and let me know. Redness is normal. It should be a deep purple to a dark red color around the nail itself and should not streak up the toe. A bright, angry red is a sign of infection, and you need to call your physician and let them know. Typically, we follow up with patients in 2 weeks following this procedure to make sure that the wounds are healthy and healing and we don't see any signs of infection. It will take a total of 4 to 6 weeks for the wound to heal. I will tell you immediately following healing, oftentimes there is a very thick callus that develops over the nail bed. It can oftentimes be as thick and look as hard as a nail. But if the nail is going to grow back, it will take 6+ months for it to grow from one end to the next end. So when this callus develops quickly after the procedure, we know it's not the nail growing back, it's simply just a callus. Thank you for watching.